Your Royal Highness, thank you for your patronage of this important work. Organizers and leaders, thank you for what you've done. And most of all, for those who work on the front lines of preventing and controlling disease around the world, thank you for your work, which is done in the tradition of Prince Mahidol. At the height of the Ebola epidemic in 2014, our staff in Sierra Leone had a beloved driver. As they went out into the parking lot, they saw that the driver was having seizures, was bleeding profusely, and tragically he died. It was at first assumed that he had died from Ebola, but he didn't. He died from untreated hypertension. He was in his 40s and had had a massive stroke. I'm going to give you the bottom line from my 10 minutes with you. With courage, we can overcome special interests and promote the public good. High blood pressure kills more people than any other condition, more than all infectious diseases combined. It's also a silent killer. During my 8 years as CDC director, I lived in Atlanta, Georgia. It's a short drive to Warm Springs. Warm Springs is the community where President Franklin Delano Roosevelt recovered from polio. It's also the community where he died at the age of 63 from untreated hypertension. That was a tragedy, but nothing like the tragedy that exists today. In his day, we had no treatment for high blood pressure. Today, we have treatments that are safe, effective, inexpensive, generic, once daily, and have been used as a standard of care in most of the world for more than half a century. And yet, fewer than 1 out of 7 people living with high blood pressure around the world has it under control. In the 10 minutes that I will speak with you today, more than 200 people around the world will die from high blood pressure. This is entirely preventable. Blood pressure isn't the only leading cause of death, also tobacco. In the 20th century, tobacco killed 100 million people, and unless urgent action is taken in the 21st century, it will kill the mind-boggling number of 1 billion people, including about a third of all cancers in the world. The title of my talk is Conflict, Common Interests, and Courage in the Control of Cardiovascular Disease and Cancer, and I'll talk about conflicts for a minute. The first are the commercial determinants of health, industries that promote unhealthy products. I worked on tuberculosis for many years. I'm a tuberculosis doctor by basic training, infectious diseases, and TB. But in all the years I worked on tuberculosis, my enemy was a microbe. And there were certain things that microbe just did not do. It did not bribe politicians. It did not rebrand itself as light tuberculosis. It did not pay celebrities to make tuberculosis seem glamorous and healthy. So the control of non-communicable diseases is harder because we're not just fighting microbes, we're fighting economic interests that are in conflict with human interests. There's also, as a result, undue influence on governmental and clinical policies. There are also conflicts sometimes between the public and private healthcare sectors. They can be seen as in competition. And similarly, there may be conflicts between doctors and non-medical providers where they may be seen as vying for authority or patients. And finally, there are conflicts sometimes between the pharmaceutical, medical equipment, and laboratory industries and those who want effective, optimal health care. Despite these conflicts, there are in fact common interests. To confront the commercial determinants of health, we can emphasize that healthier people are more productive and more creative. The Thai Health Promotion Foundation is a wonderful example of that. And leaders like Prakrit and champions for public health in Thailand are models for the world in how to counteract the commercial determinants of health. To confront the undue influence on policies, health-based policies can be shown to increase the health and economic return on health investment. And in fact, the private and public healthcare sectors, if they follow rigorous standards, can work together to increase access for patients. Similarly, team-based care, where doctors and every member of the healthcare team is a quadruple win. It increases access for patients, it reduces the cost of care, it improves the quality of care, and it increases employment in the health sector. And finally, expanded access to optimal treatment increases the market for essential medications, diagnostics, and equipment. Courage is essential for success, and one of the things that has to be done is prioritization. Sometimes you'll hear that that's unethical, that we have to do everything for everyone. But I would submit to you that focus on impact is not unethical. Failure to prioritize is unethical, because we will not make progress unless we prioritize. The single most important and effective way of improving health through public health standards is taxation. Money talks. And taxation of tobacco, alcohol, sugar-sweetened beverages, salt, and I should add carbon, can save hundreds of millions of lives. And as Her Majesty said, making unhealthy food less attractive through things like taxation is quite important. In Thailand, I understand that you are considering taxation of sodium. This is potentially a very high-impact intervention to encourage industry to reformulate. If Thailand is successful at reducing sodium consumption by a third, the global target, it will, by a rough calculation, prevent approximately 50,000 heart attacks, strokes, and deaths from cardiovascular disease each year. That's 50,000 individuals who will live longer, healthier lives, and perhaps even more impactfully, that intervention would show the world what to do, as Thailand has done in so many other areas. Regulation is also crucially important. Smoke-free places save lives. No one should be exposed to cigarette smoke in their workplace or any public place. Nicotine can be regulated out of combustible tobacco. What is the first country in the world to do so? We'll have to see. But that's probably the game changer in public health, that harmful tobacco and nicotine would not be in the same product. It's possible to be done, and it would make a huge difference. Sodium can be reduced. Trans fat, as mentioned in the introduction, artificial trans fat is a toxic chemical that kills 500,000 people a year. Thailand, again, has been a leader here, the most recent country to go trans fat free on January 9th of this year, because of the hard work and leadership of the Ministry of Public Health, the minister, and many champions. Alcohol sales and regulation of drunk driving. Alcohol gets too much of a free pass. It's a major cause of social harm. It's a major cause of cancer, and much more can be done to reduce its use. Healthcare quality can also be regulated in a way that can make a big difference and should be applied equally to private and public sectors. And warnings can be extremely effective, whether it's plain packaging of tobacco or, as the country of Chile has shown, warning labels on the front of pack to encourage industry to reformulate and improve the choices that people make. The Chile model of a warning label seems to be the one that has really changed consumption and production patterns compared to all of the others. There are other areas where courage is important. Transparency on clinical decision-making and policy and industry influence is crucial. Sunlight is a wonderful disinfectant. The ability of every provider in the healthcare sector to practice at the top of their license is key. Our ability to control costs by selecting optimal medications and expanding areas such as cancer prevention and treatment around the world. It's woefully under-addressed, just as hypertension control is. And as we heard from Dr. Drucker, there are choices where individual specific interventions can make a huge difference, and we have to prioritize those that make the biggest difference. And perhaps most importantly, we have to have the courage to try new approaches, to evaluate them rigorously, and to share the results openly, recognizing that we will have both successes and failures. Universal health coverage must be more than a slogan. Primary health care globally is the most needed and neglected area in health care, and Thailand is a model of quality, accessible care. I was moved, inspired, honored to travel to the north of Thailand earlier this week and see very dedicated community health workers, doctors, nurses, pharmacists, and others working together to improve the care of patients. Within health care, we focus on high blood pressure or hypertension. If you can get hypertension right, You can improve primary health care substantially. And by getting hypertension right, you can actually save more lives among adults than any other healthcare intervention. The approach that we've found to work, learning from countries around the world, is a five-fold approach. First, to select a simple protocol. Simple doesn't mean it's not good. Simple is often better. And simple protocols do better at saving people's lives. Different countries have selected different protocols. We don't recommend any one. All of the drugs are safe, effective, generic, and low cost. But if you select one, you have the ability to scale that up effectively. Ensuring the regular supply of drugs and logistics, team-based care with every member of the team participating, patient-centered services, rigorous accountability and continuous quality improvement, tracking the outcomes of patients and helping health workers improve their performance. In my time in public health over the last 3 decades, I've learned that there are 3 things that are essential for progress. The first is technical rigor, including rigorous information systems. So we have a technical package which, if we apply accurately and faithfully, will result in substantial progress. The second is operational excellence, good management. Bill Foege, who helped lead the global eradication of smallpox, was asked, what next after smallpox? And he said, the eradication of bad management. We're still waiting, though. In programs such as tuberculosis, there are rigorous accountability systems that allow programs to improve by tracking every patient, and most importantly, political support, because the ultimate test of good government is that it does the right thing despite special interests. Now, progress is possible, and it's happening. In recent years, cigarette sales have been falling globally for the first time in history. Thailand is a path setter in this area, but like all countries, still has more to do. At Resolve to Save Lives, we have a simple riddle. When does 50 plus 30 plus 0 equal 100? If we can increase the global control of blood pressure from 14% to 50%, reduce global dietary sodium intake by 30%, and eliminate the consumption of artificial trans fat, we can together save 100 million lives over the next 30 years. We need to recognize conflict and common interests. We need to have the courage to treat NCDs as the life-threatening emergencies that they are. We can't know which individuals' lives we will save with a tobacco tax or effective sodium reduction, but they represent people who will continue in their jobs, unlike the driver who died tragically in Sierra Leone, unlike the 200 people who have died from hypertension in the past 10 minutes. We know that working together, we can act to protect our families, our communities, our countries, and our world. Thank you very much.